Hey folks, it's Rena Jadov here, Healthier Podcast and Health Boot Camps, and I've got the legendary Dr. William Li to reveal to us what are some of the things that we don't know and our doctor isn't telling us. Dr. Li, over to you.
Well, if you want to protect your health, it starts with what we feed ourselves, feeding our health every time we sit down to eat. And there's no more powerful thing that doctors don't tell their patients is the importance of nutrition, because oftentimes they're not properly educated about the power of food. Most doctors have almost no nutrition education. And so these days, I'm finding out that people are educating their doctors by reading intelligently, getting the facts, and sharing that information around. I can tell you that one of the myths that is around is that a healthy checkup, which is what we all wish for, it's that crossing your fingers when you go to the doctor. If you get a pat on the back to say that you're healthy, that doesn't mean that you are going to be healthy. That means that at that moment in time, your doctor hasn't found a problem. I consider that the beginning of the opportunity for you to take charge of your health and consciously think about everything that you do, every food you put in your mouth that can actually help your body's defenses fight disease. So we can eat to beat disease between doctor's office visits. That's something that they'll never tell you.
What else? What else are we not being told by our doctor? Something about soy?
So one of the big surprises that doctors often don't tell their patients is that soy, which has been thought to cause breast cancer, in fact, doesn't cause breast cancer. It actually lowers the risk of breast cancer. And all the science shows us that soy has a protective benefit by having a plant estrogen that in fact blocks human estrogen and actually can lower the risk of breast cancer. And in fact, research has shown that women who already have breast cancer who eat more soy actually do better. So that's an example of a fact published that's out there that doctors are not telling their patients.
Ladies, eat more soy. Dr. Li, any other parting advice? Anything else that we don't know that our doctors are not telling us that we really should be doing every single day?
Well, I think that, many times we naturally go and have tea and coffee, and that's been done in across cultures for years. And people, again, have this fear of tea. Maybe it's too much caffeine or the coffee isn't good for you. I can tell you those two beverages that go back across cultures have been now shown by science to the tea leaf actually contains natural substances that actually protect our DNA, improve our immunity, even help coax out our stem cells, protect our microbiome, and actually can right-size our circulation. And the same thing with coffee. Coffee, if you drink 2 or 3 cups of coffee a day, it actually protects our DNA and lengthens our telomeres, which are a reflection of cellular aging. So I don't need to worry anymore about whether tea or coffee is good for you. In point of fact, what you should do is just be careful of the things that we put in our tea and put in our coffee. But the tea and coffee itself is really great for health.
And dark chocolate, I've heard you say.
Dark chocolate is another great health promoting food. It's actually one of the foods that I actually call a grand slammer, because the polyphenols that are in dark chocolate actually can help to protect our circulation, mobilize our stem cells, protect our DNA, and even help to boost our immune system.
It's fantastic. Dr. Li, thank you so much.
My pleasure. Thank you for having me on.